The BETACONNECT auto-injector is an electronic device with a battery that needs to be fully charged before you can use it for your injection. The first charge can take up to 2 hours, so be sure to plan ahead before using your BETACONNECT for the first time. Each BETACONNECT package includes a USB cord and a charger for the device. To charge your device, take the USB cord and charger, connect them to the device, then plug the charger into an outlet. You'll know when the BETACONNECT has been fully charged based on the green light bar on the device. Charging is complete when all 4 green lights are solid and not blinking, and the BETACONNECT turns off. Please note, the BETACONNECT cannot be used for injection while it is charging. Also, the USB cord must always be detached from the device when charging is complete. Otherwise, it cannot perform an injection. Before your injection, it's a good idea to familiarize yourself with the parts of the BETACONNECT device. The safety release ensures that an accidental injection is not made before you place the BETACONNECT onto your skin. The needle depth setting is set at the standard injection depth of 12 millimeters. It can be changed to a different depth, but only after consultation with your healthcare provider and beta nurse. To make your injection more comfortable, you can change the speed of the injection from low to medium to fast. The slider is set by default at medium speed, 1 full arrow. 48 hours after the injection, for 1 hour, the BETACONNECT will emit a 60-second sound every 15 minutes, and a blue light will flash to remind you of your new injection. The reminder function is in the on position when you receive the device. To turn it off, move the slider to the crossed-out bell symbol. Please note that this disables both the audible and visual reminder. Make sure that you prepare and administer your injection in a quiet and bright place. Thoroughly clean the surface where you intend to prepare your injection. Then, wash your hands with soap and towel dry. Place all the items necessary for your injection on the clean surface. Once you have prepared your medication, you are ready to start the injection process with the BETACONNECT. First, turn the BETACONNECT on by firmly pressing the on-off button on the device. Press down for at least 2 seconds. You will hear a beep when the BETACONNECT turns on. Next, double-check the battery status by looking at the green bars. 4 green bars means you are fully charged. 1 flashing green bar means there is enough power for 1 injection, but the BETACONNECT must be recharged right afterwards. If the on-off button flashes with an orange light, it means the battery is low and no injection can be performed until you have recharged the BETACONNECT. Now it's time to load the pre-filled syringe into the BETACONNECT. With the protective needle cap still attached, place the syringe into the syringe holder according to the white indicator marks inside the BETACONNECT. Push the syringe down with your thumb and forefinger evenly and gently on the middle of the syringe so that it securely locks in place. Next, close the lid firmly. You should hear it click. The injection button will light up with a steady blue light, indicating that it is ready for use. If the injector lid is not snapped in place, it is impossible to administer the injection. You may prefer to cool the pre-selected injection site briefly before injection. Use a new alcohol wipe for cleaning and swab in one direction only. Let the skin air dry and discard the wipe. Then, remove the protective needle cap by simply pulling it off. Be careful not to twist the cap off, and also take care not to touch the safety release. Position the BETACONNECT with slight pressure on the pre-selected injection site and at a 90-degree angle. The blue injection button will begin to flash once the BETACONNECT is placed on the injection site. It is now ready for injection. Next, press and release the injection button using your thumb or forefinger. There is no need to keep the button pressed during the injection process. Keep the BETACONNECT in this position for the entire duration of the injection process. This can take about 17 seconds, depending on the injection speed setting. The injection process is quiet. You can follow the status of your injection by watching the solid blue lights progress down in the status window. The injection is complete when you hear 2 short beeps and see the blue bar start to flash. It will shut off automatically. The BETACONNECT should only be removed after you see or hear these signals. If a red blinking light is shown in the window, this means the injection process was interrupted. Consult your healthcare professional if the entire dose was not received. After the injection, if you find it helpful, you may also cool the injection site for a few moments. Don't massage or rub the injection site after your injection. You can now remove the syringe from the BETACONNECT. Push the blue lid release button and reopen the injector lid. Using your thumb and forefinger, grasp the syringe by the glass body and remove it from the BETACONNECT autoinjector. Carefully pull the syringe upwards out of the syringe holder, making sure not to injure yourself. Always check that the full dose has been delivered from the syringe. Immediately after your injection, always discard the syringe into a suitable waste container. The safety release must be kept clean for the BETACONNECT to function properly. If necessary, clean your BETACONNECT with an alcohol wipe or clean cloth dampened with water only and let it air dry. Never submerge or put the BETACONNECT under running water. It should also never be placed in a dishwasher. Now close the injector lid again and store your BETACONNECT in the transparent storage case until your next injection. The BETACONNECT has a built-in reminder function that will signal when it's time for your next injection. You may want to keep the device in the transparent storage case in a place that will let you hear and see the reminder. BETACONNECT is only for use with syringes from the beta-furon retail pack and should only be used with a syringe filled with medication. The device should never be pointed at another person or yourself, except to inject beta-furon. The BETACONNECT is not intended for use by more than one patient due to the danger of infection. The device cannot be sterilized or submerged in any liquid, and it may not be opened or repaired. If your BETACONNECT malfunctions, check to make sure that the battery has been fully charged before injection, the correct syringe type is being used, and that the syringe is seated between the snap-fit clasps. Also check that the mix-ject adapter, including the needle, is tightly attached to the syringe. Do not use the BETACONNECT if any of the following happens. During normal use or during recharging, the device does not function as described in the instructions. The device seems to be damaged. The charger and cables provided are not available for use. Contact your MS nurse and physician to replace the BETACONNECT if any of these problems occur. Do not use the BETACONNECT if either of the following happens. The pre-filled syringe cannot be inserted or removed as described. The syringe has not been emptied completely after use. Your MS nurse and physician will replace the BETACONNECT if any of these occur.